Hello again, everybody. Welcome to Module 7. We're certainly making our way through the course. We're almost there. Um, so the topic of this module or this week is on self-care. And as you read through, so we got away from some of the material in the book now, but self-care really ties into this very nicely, and some of the things that we've read in the book, in the books that you've read in the course, but in a little different way. So self-care, why is it in this course, and why is it in health and wellness coaching in general? So let's start off by really acknowledging that there is no real accepted universal definition for self-care. It's interesting how different professions define it. Certainly in here, in some of the references that I have for you, the American Psychological Association talks about self-care, and we'll talk about that in a little bit. But um, from my world of being a pharmacist, they define self-care quite a bit differently than way psychologists would, and that self-care is something where in that profession, someone could self-treat themselves by going to a pharmacy and a community pharmacy and getting over-the-counter uh, medications to help with whatever ails them. That's self-care for that profession. Self-care within the general wellness or medical field tied in with wellness broadens it a little bit differently, or talks about it a little differently, and says, do you know when to use your healthcare resources? Like, do you know when to go to the doctor? Do you know what questions to ask when you're there? Do you know when to use emergency room services? Um, and then, of course, it talks about exercise and nutrition and those types of things. Um, but then the American Psychological Association, as you see in the material from this week, talks about personal wellness and what does this mean for me as a psychologist, for instance. And so there's three examples of um, they're kind of in the ballpark, but they're a little bit different. So we don't have a good accepted definition. We've actually attempted to define it for our programs here at Creighton for both the undergraduate degree in Healthy Lifestyle Management and the graduate degree. Really, this is what we look at in the Center for Health Promotion and Wellbeing as defining self-care. It is a manner in which each individual possesses the knowledge, skills, and values to recognize, create, and care for self and others in a way that leads to the fullest sense of personal well-being. Self-care should not be linked to self-centeredness, as self-care becomes more fully developed through an understanding of the importance and the connections with others and with the community. So that's how we look at self-care, as not as self-serving or not as individualism, but understanding self-care in that for me as a health coach, I can't really be fully good out here working with other people unless I'm doing okay here. And that's what self-care means for us in the fullest sense of what self means, of what well-being means, of what health means, and all the components and the aspects that we talk about in this course and in the subsequent courses. But the important part of that is us as health and wellness coaches. It's important for us to teach self-care to other people because we view our jobs not as people on a rescue mission where somebody has diabetes and we're going to rescue them from having a heart attack. It's not it. What we're hoping to do, what we want to do, what our mission and goal is to work with other people so that they can then get to the point to help themselves. It's not doing something for other people, but it's doing something with them. But that the individual we're working with is really the driver. And that conjures up a lot of other positive pieces if we look at it from that way, because then the power shifts from us to them. And then they feel like they have the autonomy and the power to make their own decisions for the right reasons that they deem as appropriate for them. the other part of this that's important is that this community aspect, and that for us to be um, fully well, it's not about just what exists inside our own bubble as we live our lives. It's about us being able to serve and do as we are supposed to, what our calling is in this world, for what we feel good about doing, and for what we are called to do by society. And for us to be able to do that, self-care is important, because we can't fully um, do what we are asked to do unless we are taking care of ourselves at the same time. So that's a bit on definitions and how we view it, at least within our program. Why is this important for a health and wellness coach? As I mentioned, for us to be good away, we got to be good on the home front first. And so one of the things that I like to bring up to students is, and perhaps you've experienced this before, is that when you're in the health and wellness field, you are an example, right? So like it or not, people look at you as an example of how to live their life in certain respects. It might be your personal health behaviors, but it might be your general approach to life. And so there is a bit of, I guess, no other way to say it, but pressure to have others perceive you as being this person who knows what's going on with health and with self-care, and how to live a healthy life. So we are, fortunately or unfortunately, scrutinized about what we're eating. Are we exercising? I mean, it's mostly those two things. What body weight is like? Are we on, taking care of ourselves in other ways? The reason I bring this up is not to look at that in a way that it's a burden, but more so look at it as in a way that it's a gift, because if you get away from individualism and you are taking care of yourself for the purposes of doing what you're called to do, then you have a different viewpoint of why it's important to take care of yourself, and it becomes more than just you. It becomes something greater than that, and so it's a gift in that now community is involved with how you live your life. Some people don't like that, I guess, but the community is part of your life, whether you want it to be or not. And having the community help hold you accountable to your the way you take care of yourself is an okay thing. So I think those things are probably not so much a burden as they are a real opportunity and gift. The other point I wanted to make about that is you have a real opportunity in this regard to show others how to live your life. And I'm not talking about working out 80 hours a week, or only eating what you would deem as the most ideal eating plan. But it's about the whole thing. It's about your whole person health for you. So how do you approach life? What is your lifestyle balance like? What is your balance in overall life like? And this is your opportunity, is to show people that, show others that how to live your life in balance. You may not have the perfect body weight. You may not have the perfect amount of exercise. You may not eat perfectly, and that is all okay, because guess what? We're all human. And this is what we have an opportunity to show people, is that our own humanity is okay, and coming to terms with our humanity relative to society, and living within the social structure and context that we live in is an okay thing. And so how does that look for me and my balance? How does that look for you and your balance? Well, we're unique in that way, but we have an opportunity to demonstrate that. So You incorporate things such as how you handle stress and pressure. Are you getting enough sleep? Are you taking breaks when you need to? Or, are you showing the world that what's most important is that I exercise, 80 hours a week and have 0% body fat or whatever it is, which by the way isn't healthy. So you get to pick that. This is part of self-care. This is something for you to reflect upon. How does the world view you? If you're the health coach, people are going to look to you on how to live healthy. And what does it mean? What do you want people to see in you? Because it's not all about what you say. It's really more about what you do. That is the message to people. And so how does that work for you? And so just a little anecdote. I, like other people, really was caught up for a long time in my life of little sleep, just plowing through work, getting the most done, and not long ago. I had to say this is not balanced. I'm supposed to be balanced. The irony is I teach people how to be balanced, but I'm not balanced myself. Not getting enough sleep. I'm stressed. All of the above. And so, what my wife Nancy and I did was make a commitment several months ago to getting enough sleep each night, and that's where we started, regardless of if the work wasn't done. Now, of course, we made sure that our kids had what they needed and that type of thing. But oftentimes what our lives were like is we would just, we'd get the kids what they needed, and then we would just start into work at nighttime. And, we weren't enjoying each other. We weren't enjoying our lives as they should be. We didn't have balance. So we decided to pull the reins in a little bit and say, we recognize that there's going to be fallout from this. We probably aren't going to get some things done that need to get done as far as around the house or with jobs or whatever tasks that need. But this is part of the balance because we need to have something different for ourselves, and it has been fantastic. There's been fallout. There's things that haven't gotten done that need to get done, but at the same time, we have been able to come to terms with what that means, and so we're getting more sleep. Our stress level is lower, and consequently, a lot of other things come in line when those things happen. We tend to eat better. We're more consistent with exercise. Our relationships with each other, with our children, with our family, with our coworkers are better. All of those things tend to get better once we take care of our basic needs and feel like we have the power and the control of our own life. Just as by way of example, this is something that is important for all of us to get a grip on, and this is why I included that slide deck from American Psychological Association on psychologists. And even though I'm not, please don't interpret this as us being psychologists, because we are not. But there are some similarities in health coaching and a psychologist, in that you are working with other people and trying to set a good example, and obviously the professions, whatever they are working long hours, and I like how they laid out that slide deck in early practitioner, mid, and late life practitioner, and what wellness means, and self-care in that regard. So that's why I included that slide deck. The purpose of then this module, one of the components of this module is to have a self-care project. Self-care is one of the philosophical foundations for the program, and so it makes sense for us to have a project for you to work on. Now, why do we do this, and why do we do it in the first course? Well, keep in mind when you do this in this course that it's largely focused on lifestyle medicine. But as you go through your other courses in the program, there are other opportunities to incorporate self-care there. So you get a different perspective of self-care in some other courses too. But So this one is largely focused on lifestyle medicine, and it's consistent with this course. But there's really three main reasons why it's important for you to do a self-care project at this point in the program. One, it helps to achieve balance at the beginning of your program. So what we would like to do is, in this project, as you've seen from the instructions, you have to design your own self-care program. This is for you. This isn't for someone else, but this is just for you. Part of that reason is so that you can start developing, if you aren't already doing so, these habits of balance. And the second reason is we know that achieving balance in this way, getting enough exercise, eating right, getting enough sleep, managing your stress, all of those things help with engagement and academic success. So there's good literature to support that you're more engaged in, if you just want to talk strictly about school, you're more engaged in the material and you do better. Your performance is better on the material if you're doing those things in a balanced way. So that means enough exercise, the right kinds of foods and enough food and not too much food, the right amount of sleep, for instance. So there's great literature to support academic success there, as there is literature to support engagement and job success also. So that's the second reason. And then thirdly, it's a great way to practice this. So when we're working with other people, becoming our own first person that we're working with is a great way to learn some techniques about ways to coach others, is to coach ourselves first, because we reflect on some of these questions. We ask ourselves questions that we would ask other people. We design a program for ourselves first so that we know what it's like. We're better able to do that for others if we've done it for ourselves first. And we've used that same sort of technique, at least I have academically for many years now, and it seems to work. And others have used this. It's not something that I created, but becoming your own first patient is something that has been around in health sciences for quite a while. So that's it. That's self-care. I feel very passionate about this. I only skim the surface of what self-care means. A lot of my research now is related to self-care. And I would love to have further follow-up conversations if anyone is interested in this as well. But have fun with this module. I'm looking forward to what the discussions are like here, and certainly looking forward to what your self-care projects turn out to be. I'm sure they're going to be wonderful. So as always, if you have any questions, shoot me an email, pick up the phone, let me know. I'm happy to help where I can. All right, have a good one, everyone. Talk to you soon.